As we age, our bodies communicate through subtle signs like itchiness, which can sometimes signal underlying health issues. In this video from Elder Stories, we'll reveal 4 areas where persistent itching could be a warning, helping you stay ahead of potential health concerns. Persistent itchiness on the lower legs. One of the most overlooked but telling signs that something deeper may be going on in your body is a constant itch on the lower legs. It's easy to chalk it up to dry skin or aging, but when this area becomes noticeably itchy without any visible rash or irritation, it might be time to take a closer look. Doctors have found that older adults who frequently scratch their calves, shins, or ankles may be experiencing poor circulation, specifically a condition known as peripheral artery disease, PAD. This means that blood isn't flowing as freely through the small vessels in your lower limbs, and that limited circulation can cause the skin to become dry, sensitive, and unusually itchy. Let's think about 2 men, Harold and Dennis, both in their early 80s. Harold enjoys taking short walks around his neighborhood every morning. He stays active, checks his feet and legs regularly, and hasn't noticed anything unusual. Dennis, on the other hand, has been less mobile these days. He feels tired more often, sits for long stretches, and has started noticing a persistent itch creeping up his legs, mostly at night or after sitting for a long while. He applies lotion, thinking it's just dry skin, but it doesn't really help. What Dennis doesn't know is that this itching could be his body's way of signaling that blood isn't reaching the lower part of his legs as efficiently as it used to. When your legs aren't getting proper circulation, not only does the skin dry out, but the muscles and tissues also start to weaken over time. This puts extra strain on your heart, veins, and vascular system, and poor circulation has been linked to higher risks of heart disease, stroke, and even cognitive decline. The importance of blood circulation in older adults. As people age, blood circulation tends to slow down. This can happen for various reasons, including the natural narrowing and hardening of arteries, or even a lack of physical activity. Peripheral artery disease, which is common in older adults, is a condition where the arteries that supply blood to the limbs become narrowed or blocked, leading to a reduction in blood flow. This can result in several symptoms, including persistent itching, swelling, leg pain, cramping, and fatigue. Older adults are particularly vulnerable to PAD because of factors like a sedentary lifestyle, high blood pressure, high cholesterol, and diabetes, all of which can exacerbate poor circulation. Even though PAD is common among the elderly, many people overlook its symptoms, assuming they're just part of the aging process. However, early detection and intervention can significantly improve the quality of life. Managing poor circulation. The good news is that with proper care, the effects of poor circulation can be managed and even reversed, especially if detected early. For older adults experiencing persistent itching or discomfort in their lower legs, it's crucial to stay active. Physical activity, particularly walking and leg exercises, can help improve blood flow. Exercises like ankle pumps, calf raises, or gentle stretches can also encourage circulation and prevent stiffness. In addition to exercise, lifestyle modifications can make a big difference. Staying hydrated is essential, as dehydration can worsen circulation issues. Elevating the feet whenever sitting or lying down allows gravity to help return blood flow to the legs, relieving some of the strain on the circulatory system. Wearing comfortable, well-fitting compression socks can also help, as they promote blood circulation by gently applying pressure to the legs. Eating a heart-healthy diet low in salt and processed foods, and high in fiber, lean proteins, and healthy fats can also contribute to better overall vascular health. Unexplained itching on the upper or mid-back. An itch in the middle of your back can be hard to reach, but what if it's trying to send you a message that matters? Many older adults experience persistent itchiness on the upper or mid-back, and while it's tempting to blame it on dry skin or an old shirt tag, this kind of itch often points to something much deeper. In fact, one of the lesser-known but serious causes of upper back itchiness is a problem with the liver or kidneys, two of the most vital organs responsible for filtering toxins from the body and maintaining internal balance. When these organs are struggling, waste products can build up in the bloodstream, irritating the skin and causing it to itch, especially in places like the back, where there's a high concentration of nerve endings. Take Dorothy and Janice, both 76 years old. Dorothy gets regular checkups, drinks plenty of water, and has always had good skin. Janice, however, has recently been feeling more tired than usual, noticed some swelling in her ankles, and has started scratching her back more often, especially at night. She's tried changing her laundry detergent and moisturizing regularly, but the itch remains. What Janice doesn't realize is that this constant itch could be her body's way of signaling that her kidneys are under strain or that her liver isn't processing toxins as effectively as before. And when these organs aren't functioning properly, it can affect everything from digestion and sleep to energy levels and mental clarity. Itchy skin caused by liver or kidney dysfunction is typically persistent, doesn't respond to usual remedies, and often appears without any rash. It's also more likely to occur at night, making sleep difficult and draining your energy even more. Liver and kidney health in older adults. As people age, the liver and kidneys may start to lose some of their efficiency. The liver, which detoxifies the body, can become less effective at processing waste and harmful substances. Similarly, the kidneys, which filter excess fluid, waste, and toxins from the blood, may not work as efficiently, leading to a buildup of toxins in the body. This is especially common in people with conditions like diabetes, high blood pressure, or a history of alcohol consumption. Impaired liver and kidney function can lead to more than just itchy skin. Swelling, fatigue, digestive issues, and difficulty concentrating can all be signs that these vital organs need attention. For older adults, it is crucial to get regular checkups to monitor liver and kidney health, especially since the early signs of dysfunction may not always be obvious. Maintaining proper hydration, a balanced diet, and avoiding excessive alcohol or drug use are all important ways to support liver and kidney health. In addition, regular physical activity can help improve circulation, reduce swelling, and keep the body's systems working as efficiently as possible. Managing itchy skin due to liver or kidney problems. If persistent itching doesn't go away with regular moisturizing or a change in laundry detergent, it's time to consult with a healthcare provider. A doctor may recommend blood tests to check for liver or kidney dysfunction. They might also ask about your overall lifestyle, such as diet, fluid intake, and any medications you take, as these factors can impact organ health. For those experiencing itchy skin due to liver or kidney problems, treatments will typically focus on addressing the root cause, which may involve medication, dietary changes, or lifestyle adjustments. In some cases, managing underlying health conditions such as diabetes or hypertension can greatly improve symptoms. It's also important to avoid scratching, as it can lead to skin damage and infections. Frequent itching on the scalp or neck. When older adults begin experiencing persistent itchiness on the scalp or back of the neck, it's often mistaken for something trivial. Maybe dry skin, maybe a reaction to shampoo, maybe just part of aging. But there's more going on beneath the surface. For many seniors, this kind of itch isn't just about the skin. It's tied to something deeper: stress, inflammation, and in some cases, changes in the nervous system that can affect both physical and mental resilience. The nerves around the scalp and neck are highly sensitive, and they're often the first to react when the body's under strain, especially emotional or neurological strain that has been building slowly over time. Let's take two men, Leonard and Ray, both in their late 70s. Leonard stays socially engaged, spends time gardening, and practices light meditation in the evenings. He's always had a relaxed way about him. Ray, on the other hand, has had a tougher time adjusting to retirement. He feels restless at night, spends more time indoors, and has been carrying a lot of quiet stress without even realizing it. Over the past few months, Ray began scratching his head more often. First just in the evenings, then throughout the day. No rash, no flakes, no real explanation. He tried switching shampoos and bought a new pillowcase, but nothing helped. What Ray didn't know is that this itch was likely a physical expression of emotional tension and nervous system fatigue. As we age, our stress response becomes less efficient. Instead of calming down after a moment of worry, the body tends to stay in a low-grade state of alert, keeping cortisol levels high and immune function suppressed. That tension often gets expressed in the most sensitive nerve endings, like those found on the scalp and back of the neck. Chronic itching in this area has also been linked to conditions like neuropathy and even early signs of cognitive decline. The role of stress in elderly health. As we age, the body's ability to respond to stress diminishes. Chronic stress can lead to a range of health issues, including heart disease, high blood pressure, and weakened immune function. It can also affect the nervous system, which controls many functions in the body, including the skin. The scalp and neck are areas with a high concentration of nerve endings, which may be particularly sensitive to stress and emotional strain. In older adults, stress can be triggered by a variety of factors, including isolation, loss of loved ones, or difficulty adjusting to lifestyle changes, such as retirement. Prolonged stress can also impact the quality of sleep, mental clarity, and overall well-being. This makes it crucial for seniors to find ways to manage stress through relaxation techniques, social engagement, and mental health support. Addressing itching from stress and nerve issues. If itching on the scalp or neck persists and is not due to external factors like shampoo or dryness, it's important to consider the possibility that stress or neurological issues may be involved. Seeking medical advice from a healthcare provider can help identify the underlying cause. In many cases, stress management strategies such as meditation, exercise, or therapy can help alleviate both the physical and emotional symptoms. It's also important to pay attention to any other changes in cognitive function or mood, as persistent stress and itching may be early signs of more serious conditions such as neuropathy or even dementia. By addressing stress early and seeking the appropriate treatment, seniors can significantly improve their quality of life and reduce the impact of these symptoms. Ongoing itching around the chest or abdomen. When people think about signs of declining health, they usually imagine things like shortness of breath, dizziness, or memory problems. But the skin on your chest and belly, yes, right across the front of your body, can quietly speak volumes about what's happening inside, especially when it starts to itch without any clear cause. Older adults who frequently experience itchiness across their torso, particularly in the chest or abdominal area, may be facing more than a minor skin issue. This kind of itching is often a red flag for nutritional deficiencies or malabsorption problems, both of which can silently wear down your body's strength, immune defenses, and ability to repair itself. Let's look at two women, Joyce and Elaine, both 81 years old. Joyce still enjoys preparing her own meals, making colorful plates with fruits, greens, and a bit of protein. She doesn't eat as much as she did when she was younger, but she makes sure her food counts. Elaine, however, has slowly lost interest in food over the past year. She finds herself skipping meals, reaching for crackers or canned soup, and feeling full quickly. Along the way, she started to notice that her chest and belly itched more often, especially in the evenings, and sometimes even felt a bit tender or dry. She assumed it was just sensitive skin and tried switching body washes, but nothing helped. What Elaine didn't know is that as we age, the digestive system can become less efficient at absorbing key nutrients, especially vitamins like B12, essential fatty acids, and trace minerals like zinc and magnesium. When the body doesn't get enough of these, the skin starts to dry out, nerve signals become erratic, and the immune system weakens. The most dangerous part of malnutrition in seniors is that it often hides behind a normal-looking weight. You might not be losing pounds, but your body could still be starving for what it needs to maintain itself. Nutritional deficiencies in older adults. As people age, the body's ability to absorb nutrients decreases. Several factors contribute to this, including reduced stomach acid production, slower gut motility, and changes in the digestive tract that make it harder for the body to absorb vitamins and minerals. Common deficiencies in older adults include vitamin D, B12, calcium, and omega-3 fatty acids. These deficiencies can lead to a range of issues beyond just itching, including fatigue, brittle bones, muscle weakness, and cognitive decline. The skin, being the body's largest organ, is one of the first to show signs of nutritional imbalance. Dryness, itchiness, and tenderness in areas like the chest and abdomen could be the result of not getting enough nutrients to support healthy skin function. The skin requires essential fatty acids, vitamins A, C, and E, and minerals like zinc to stay hydrated and maintain its barrier function. Without these nutrients, the skin can become inflamed and irritated, leading to persistent itching. The hidden dangers of malnutrition. One of the challenges with malnutrition in seniors is that it can often go unnoticed. Older adults may not lose weight in a noticeable way, especially if they are still eating enough calories, but their nutrient intake may be insufficient. This is especially true for individuals who struggle with appetite loss or have difficulty chewing or swallowing. As a result, the body may not get the vitamins, minerals, and essential fats it needs to function properly, even if the person maintains a stable weight. Malabsorption, or the inability to properly absorb nutrients from food, is another common issue. Conditions like celiac disease, Crohn's disease, or other gastrointestinal disorders can interfere with nutrient absorption. These issues may not always be immediately apparent, but they can lead to a variety of symptoms, including itchy or dry skin, fatigue, and weakness. Managing nutritional deficiencies and itchy skin. For older adults experiencing ongoing itching in the chest or abdominal area, it's important to focus on a balanced and nutrient-dense diet. Eating a variety of fruits, vegetables, lean proteins, and whole grains can help ensure the body gets the vitamins and minerals it needs to function properly. In some cases, nutritional supplements may be recommended by a healthcare provider to address specific deficiencies. Regular checkups with a healthcare provider can help identify malnutrition or absorption issues early on. Blood tests can assess vitamin and mineral levels, and a doctor may recommend changes to the diet or prescribe supplements if deficiencies are detected. In addition to improving nutrition, managing underlying health conditions like diabetes or gastrointestinal issues can also help improve overall nutrient absorption and prevent skin problems. For seniors who experience itchy skin due to nutritional deficiencies, moisturizing regularly and using gentle skincare products can help alleviate discomfort. It's also important to stay hydrated, as dehydration can exacerbate skin issues. These 4 itchy spots on your body could signal deeper health issues, from circulation problems to organ strain or stress. Listen to your body as it communicates through subtle signs like itching. Don't ignore these signals. Taking small steps like moving more, eating better, and managing stress can make a big difference. Your goal is not just to live longer, but to live well with clarity, joy, and independence. Thank you for watching, and don't forget to like, subscribe, and share your thoughts with us.